Hi, everyone. My name is Anne-Marie Hayes, and I'm a research associate for the Joplin campus of KCU. Thank you for being here today for our Student-Led Journal Club series. I'll be introducing our speaker today, student Dr. George Kalu. He's our first anatomy fellow that's going to be presenting through the series. So I will introduce our speaker and we'll get started. Student Dr. George Kalu is an anatomy fellow at KCU-Joplin. He grew up in Morgan Hill, California, and earned a bachelor's in biological sciences and a minor in psychology from California Polytechnic State University, San Luis Obispo. From there, he earned a master's in medical physiology from Case Western Reserve University in Cleveland, Ohio, and after earning his master's, George taught general biology and human anatomy at 3 community colleges near his hometown. Student Dr. Kalu is currently interested in entering a career in obstetrics, gynecology, or pediatrics, as well as teaching in the future. So with that, the floor is yours, student Dr. Kalu.
All right. Thank you, Anne-Marie, for that intro. And thank you, everybody, for coming. My name is George Kalu, as she said. I'm one of the anatomy fellows at the KCU-Joplin campus. And today I'm going to be presenting some of my research on a cadaveric study of morphologies of the tensor of the Vastus Intermedius. All right, so to kind of set the table here, one of the muscles that we're going to talk about is the quadriceps femoris. And so the quadriceps literally translates to 4 heads. And so that's the way we typically think of the quadriceps muscle. It's a group of 4 muscles, and it forms the largest set of muscles in the body. And it forms the main components of the anterior thigh muscles. So the 4 muscles that make up the quadriceps femoris are the rectus femoris, which we see overlying the next 3. So we have rectus femoris on top, then we have vastus lateralis on the lateral side, vastus medialis on the medial side, and vastus intermedius in between those 2. So those 4 make up the quadriceps femoris. And the main action of the quadriceps is to extend your leg at the knee joint. So if you think about kicking your leg out, that is going to be the main function of the quadriceps muscles. And so this is going to be involved with a lot of our daily activities, like walking, running, jumping, getting up from a seated position or a squatting position, as well as climbing and walking upstairs. In addition to that, it's also really important in bent knee sports like skiing and tennis to kind of stabilize the knee joint as well. And it kind of acts as like a brake system when you're walking downstairs or walking downhill in order to make sure you're not walking faster than you can you can control. And this muscle is also innervated by branches of the femoral nerve. So when we look at the quadriceps muscles, those 4 muscles are all going to have different origins. So they're going to originate at slightly different spots. Rectus femoris is going to originate at the anterior inferior iliac spine and the ilium. Vastus lateralis is going to originate at the greater trochanter of the femur, and as well as the lateral lip of the linea aspera. The vastus medialis is going to originate around the intertrochanteric line and around the medial lip of the linea aspera. And then vastus intermedius will attach around the anterior femur, as well as the lateral surfaces of the femur as well. So even though we have 4 different muscles here, they're all going to converge at a tendon called the quadriceps tendon, which we're seeing here. And so when these 4 muscles converge, that's going to form our quadriceps tendon, and that is going to insert onto the patella or your kneecap. And then indirectly, it's also going to insert on the tibial tuberosity, which is that bump on the top of your shin, by way of the patellar ligament, or more commonly referred to as the patellar tendon. So why is the quadriceps femoris so important? This muscle is really important, especially clinically, because with a lot of knee injuries, it's very common for quadriceps to become weaker. So for example, with injuries with the quadriceps tendon tears or patellar ligament tears, or ACL and PCL tears, or as well as tearing the quadriceps itself, those can all lead to quadriceps weakness. So naturally, in order to rehab this, physical therapy is going to focus on re-strengthening the quadriceps muscles. And that can be done with a number of different exercises like straight leg raises, resistance knee extension exercises, things like that. And then another thing that's kind of interesting too is that in order to reconstruct certain knee ligaments during surgeries, the quadriceps tendon can actually be used to help reconstruct those ligaments, like the ACL, the PCL, the medial patellofemoral ligament, as well as the fibular collateral ligament too. So all of that brings me to my research project, which was looking at a potential fifth muscle that's found within the quadriceps group. So like I said before, the quadriceps is typically thought of as being made up of 4 muscles. However, in some people, a fifth muscle has been seen. And so that muscle has been named the tensor of the vastus intermedius. So there's been a lot of debate about whether the TVI, or tensor of the vastus intermedius, represents a variation in the quadriceps, or if it's actually a consistently found fifth component of the quadriceps muscle group. What's also really important, and what's kind of clinically important here, is that because it's a newly recognized muscle, a lot of orthopedic surgeons have been unaware that it even exists, which is not ideal, because if you're a surgeon, you want to be fully aware of everything that's in that area that you're operating on. And then on top of that, physical therapists, because again, this is a newly recognized muscle, have no way of knowing how to engage it for injury recovery and for muscle rehabilitation. So just a little bit of information about the TVI, and I'll show some pictures as we go. The TVI is typically found between the vastus lateralis and the vastus intermedius. However, more rarely, it can be found in between vastus intermedius and medialis. What's also interesting is that this muscle can actually fuse with either or both muscles, which is probably why it's been so difficult to even know that this muscle even existed to begin with. And so on top of that, it also has a really long tendon, and it actually joins with the quadriceps tendon, kind of reinforcing the fact that this is actually part of the quadriceps muscle group. The function of it is kind of unknown. We don't really know what it does, but it's hypothesized that it's a possible stabilizer of the knee joint, and it may even help with extending the knee with the rest of the other quadriceps muscles. But that's still to be determined, especially because of some of the multiple morphologies that we're going to see with that. So there's a lot of different shapes and morphologies that the TVI can take, including variations within the origin itself and its insertion and the way it originates and inserts within the lower limb. So that leads me to my goal of my project, which was to identify the prevalence of the TVI muscle, as well as examine the different variations in its morphology. Okay. And so we're going to see some cadaver pictures as we go, but before we get into that, I want to get into some of the past research that's been done on this very briefly. And so this muscle has been something that's kind of been looked at throughout the last 100 years, but not really consistently until recently. And so the first time it was really looked at in depth was within the late 80s and early 90s by a group led by Golland and Willen, where they identified a fifth muscle within the thigh that lied in between vastus lateralis and vastus intermedius. And they found it in about 36% of the thighs that they looked at. And they also found that it actually fused with vastus lateralis or intermedius, and it contributed to the quadriceps tendon. After their research was done, it really wasn't looked at again until very recently. And so in 2016, this group led by Carl Grob kind of took this over, and they were able to identify it and identify the TVI and name it between vastus lateralis and vastus intermedius. And they actually found it in all 26 of the lower limbs that they dissected. And then in doing so, they also created a classification system based on the way the TVI interacts with vastus lateralis or vastus intermedius. And so this was his classification system here. So there was five main types. The first one was the independent type, where the TVI was not attached to either the vastus lateralis or the intermedius. It was its own independent muscle group or muscle. The next one was the VI type, where it was attached and fused with vastus intermedius, but could be easily separated from vastus lateralis. There's the VL type, which was the other way around, where it attaches to vastus lateralis, but could be easily separated from vastus intermedius. There's a common type where it was attached to both. And then there was also a 2 muscle belly type as well. And then the following year, his group was able to identify the TVI both by gross dissection and via MRI. That same year, a group by Viramani and Nanasekaran were able to identify the TVI in all 36 of the lower limbs that they dissected in a South Indian population. And they used the classification system created by Grob in order to help identify and classify the muscles that they were able to see. A few years later, a group led by Ruzic identified a TBI that actually had three heads. And so this is what we're seeing here. So here's the main TBI muscle. Again, it's lying in between vastus lateralis and vastus intermedius. Here's the first head, here's a second head, and this third head over here. And all had slightly different origins. So this was the first time that we saw more than just two heads associated with the TBI. A few years later, another group by Olunek identified TBIs in 64% of 106 lower limbs that they had dissected. And what they found is that there was actually a lot of variation in the origins. And so the classification system led by Grob didn't really suffice. And so because Grob's system assumed the same origin for all the different TBIs, but he found that the origins were actually different. And that led to different morphologies. And we'll look at his classification system in a few slides. And so he organized it by the origin and the muscle belly shape. In that same year, Ogami Takamura, his group identified the TBI via CT scans, and they found it in 14 out of 15 thighs via CT scans. And so that's what we're seeing here. So this was the original scan. And then this bottom picture is the scan with the muscles outlined. So this scan with the 7 kind of around it is the vastus lateralis. And the red component next to it, just medial to that, is what they refer to as the target muscle, which was the TBI. And then from there, they were also able to identify the TBI in 35 lower limbs by gross dissection, and they classified them based off of a Grob system. From there, Ruzic kind of came back and identified a 2-headed TBI, and one of those heads actually arose from the vastus medialis. And so this was kind of the first time that we were able to see the TBI not showing up between vastus lateralis and vastus intermedius, but then in between medialis and intermedius. Sam et al. Found TBIs in about 44% of lower limbs, more commonly in the left side than the right. And they also looked at it via MRIs and was able to identify it in 4 out of 12 lower limbs. And then they went back retrospectively and looked at, and were able to identify the TBIs in about 30% of patients. Another group by Sahinis found it's about 21 subjects, about college-age subjects, and they were also able to identify the TBI by ultrasound, by ultrasound in all 21 of those individuals. And then another interesting study was done by a Japanese group led by Utsunomiya, and he was able to identify the TBI within human embryos. And so embryos are staged by Carnegie stages. So the ones in question were Carnegie stage 21, 22, and 23. And he was first able to see the TBI as this crescent shape in the Carnegie stages 22, which was later than the appearance for all of the other quadriceps muscles. And then, so he was able to see that in about 7 out of 10 limbs. And then in Carnegie stage 23, he was able to find it bilaterally in all but one embryo in Carnegie stage 23. Okay, so as we can see based off of all the studies, there's a lot of variation in the prevalence based on the study that you're looking at and where it's found and how it's found. And so my study was trying to see if we could identify it and look at the different morphologies of it. So what I did was I dissected 48 lower limbs between the Joplin campus and the Kansas City campus's anatomy labs and exposed the quadriceps muscles. And so if I was able to find a TBI, I would analyze its morphology and the neurovasculature, and I would take measurements on it. And I would classify them based off of Olunek's system. And so the first cut that I made was along the the inguinal ligament, and the second one down the midline of the thigh, and the third one just below the tibial tuberosity. So this is what Olunek's classification system looked like. So it was grouped into 3 subtypes. The first type, type 1, indicated a single 5th muscle that was independent. Type 2 was a 5th muscle that grew out from other muscles. And then type 3 was where we had multiple supplementary heads, so 2 heads or more. Here's my results. And so what I found was that out of the 48 cadavers that I looked at, 30 of them actually contained at least one TBI. And when I say at least one TBI, I mean at least one, if not multiple heads of the TBI. Okay. So of those 48 cadavers, of those 48 cadavers, 28 were male, and almost 68% of them contained at least one TBI. 20 out of 20 female cadavers, 11 of them contained at least one TBI, so about 55%. From there, about 24 of those 30 cadavers contained a TBI on only one thigh. 6 cadavers had it bilaterally. Of the total of 96 thighs that I looked at, 22 left thighs contained at least one TBI, and 14 right thighs contained at least one TBI. And then in total, I found 48 TBIs. Again, some had multiple heads, so I'm counting each head as one TBI. 33 of those TBIs were found on left thighs, and 15 TBIs were found on right thighs. And all the TBIs that I found were supplied by the lateral circumflex femoral artery and branches of the femoral nerve. So I found 6 different morphologies based off of a Lunic system. So I found 4 type 1As. The vast majority of the ones that I found were type 2A, so this made up about 56%, okay, 20 out of 36. About 25% were the type 2Bs. And then I found 1 type 3A TBI, 1 type 3B TBI, and 1 type 3D TBI. So I'm going to show you some cadaver pictures on the ensuing slides. So the first one that I wanted to show you is the type 1A. And so a type 1A TBI is where we have a single fifth head that arises from the greater trochanter, and it lies it lies in between vastus lateralis and vastus intermedius. Okay. And so here we're seeing vastus lateralis. Down here we see vastus intermedius. Here we see vastus medialis. And over here is rectus femoris, kind of moved out of the way. So those are our 4 main muscles. And then here we see this 5th muscle lying just medial to vastus lateralis, and that is our tensor of the vastus intermedius, our TBI muscle. Okay. So we see 5 muscles here. Oops. Here's another picture. This one got a little shredded up in the process here, but we still see everything that we want to see. So here's vastus lateralis, again, vastus intermedius, vastus medialis. We're not seeing rectus femoris in this picture, but here we see this TBI muscle lying in between vastus lateralis and vastus intermedius. And you can see it has a separate tendon from the tendon of vastus lateralis, which we see over here. And here's a tendon of the TBI coming down and joining with the quadriceps tendon. Here's the type 2A muscle. And so the type 2A TBI is where we have the TBI growing out of the vastus lateralis. Okay. And so again, here we see vastus lateralis here. Here is vastus intermedius. Here's rectus femoris. Vastus medialis is down here at the bottom. And then we see this 5th muscle growing from vastus lateralis, coming across and actually attaching right on top of vastus intermedius. And so that would be our type 2A TBI. Okay. And as we can see, it has a much different shape and shape and morphology compared to the type 1A. Okay. Here's just another angle of it. Again, here's vastus lateralis, vastus intermedius, vastus medialis, rectus femoris, and our TBI coming across and attaching onto the medial surface of vastus intermedius. Here's type 2B. And so type 2B, this made up about a quarter of the ones I was able to see. And so instead of growing from vastus lateralis, it would actually grow from vastus intermedius and extend out to vastus lateralis. So kind of going the other way. And so this is what we're seeing here. So we're seeing vastus lateralis here, vastus intermedius. And here we see, it's a little harder to see because we have some of the vasculature in the way, but I have other pictures. Here we see the TBI coming from vastus intermedius and inserting into the tendon of vastus lateralis down below. Here's another picture. So again, here is tensor fascia lata on the lateral side, Here's vastus lateralis, vastus intermedius here, and we can see our TVI running from vastus intermedius all the way down and joining with vastus lateralis more distally. Okay, and again, joining with the tendon there. And here's just another angle of this picture, or of the same cadaver. Okay. Here's another picture, and again, here we see the TVI joining from, or running from vastus intermedius down to vastus lateralis. And interestingly, I was actually able to find a two-headed TVI, a type 2B type TVI. And so again, here's vastus lateralis, here's vastus intermedius. And here with the red pin, I've indicated the lateral head of this TVI. And here with the yellow pins, I've indicated the medial head of the TVI. And again, both are coming from vastus intermedius and joining with vastus lateralis more distally. The next one was the type 3A. And so the type 3A TVI is where we have multiple heads. In this case, we have two heads with a single common tendon. And they run from the greater trochanter and join with the quadriceps tendon. And so here we see two different heads on our TVI. Again, here's intermedius, here's lateralis. Here we see the first head indicated with the green pin. And then we kind of see this line here indicating this break point. And here's our second head indicated with the red pins. And we see them joining and forming a common tendon just distally to that. And so this was the only type 3A that I found. But as you can see, it has a single super slender tendon that comes all the way down. And again, will run down and join with the quadriceps tendon. Okay. Down below, I have a kind of a zoomed in picture of the tendon itself, kind of joining with the quadriceps tendon. And the picture on the right just shows a proximal view starting down at the bottom and a distal view towards the top. So the kneecap's up at the top, hip is down at the bottom, and we see this long tendon running all the way down the length of the femur. This next one was the type 3B, and again, I was only able to find one of these. But this is where we have two heads with two separate tendons. And so here we have vastus intermedius, vastus lateralis we can't see here, but here is our TVI. So here's one TVI with a single tendon, and here's a separate head with a single tendon across this side here. And then the last one was our type 3D TVI. And this is where we had 4 different heads. And these 4 heads is a little different than the classification that Aluna came up with, because this one actually grew out of the vastus lateralis. And so I indicated the 4 heads with these pins here. And so the first head is marked here with the green pin. Then we see a break point, and then we see the second head over here. Then we see a break point and a third head over here with this red pin, and then a fourth head over here with this yellow pin. And these will all join with the tendon of the tendon of the vastus intermedius. So this one looks also very differently than all of the other different types. This is just another view kind of showing the 4 different heads. So here's one head, here's a second head, here's the third head, and then the fourth head down below, or more distally. Okay, so with all that being said, what's kind of the future direction that this project may take us is that we may need to rework this classification system by Alunic. It worked really well for the most part, but it may need to be reworked to account for the fact that we had multiple heads for the type 2B TVIs, as well as the TVI, the type 3D TVIs arising from the vastus lateralis, instead of from different parts of the femur, like was indicated with Alunic's classification system. These were his results that he came up with. My results were vastly different from his for the most part, with the exception of a few of the subtypes. And so that can be an indicator that we may not really know how many of all these different subtypes there actually are. And then an interesting finding that I found was that the longer a muscle was, the shorter its tendon tended to be. Another thing that I found interesting was that for the type 1A and the type 2A, the muscle bellies tended to be about the same size and length, but the type 2Bs tended to be much smaller than either type 1A or the type 2A. However, the tendon length tended to be about the same between all three. So I thought that was kind of interesting as well. The thing that I probably found the most interesting was looking at the tendon for the type 3A TBIs and with it being so slender. And so my biggest question with this is, what would the function of this tendon be, or of this muscle be, with such a small tendon? Typically, tendons will have a larger strength if they're shorter and wider. But if we have such a long, slender tendon like this, that's much smaller than all of the other ones, what would its function be? Does it have a significant role with knee stabilization or with knee extension? Or does it kind of serve a more ancillary role? And I'll kind of get into that a little bit more too. So that's another question that came across with this. So some future directions with this study would be to kind of identify the tensile strengths for all the different morphologies of the TBIs to establish their abilities when it came to knee stabilization and knee extension, and determine what their roles might be with that, if any. And then another future direction that may arise with this is to maybe ultrasound individual thighs and determine if we're able to see different subtypes of the TBIs based on either Grob system or Ohlunic system. What I would probably do is use more of Ohlunic system just because of the variations in the origins and morphologies. So with this project, there was a lot of unanswered questions that arose with this. The biggest one to me was does it make sense to continue teaching the quadriceps as a 4-membered entity and talk about the TBI as a possible variation? Or does it make more sense to start talking about it as a 5-membered muscle? Okay, and if we do that, then we would have to change the name to either pentaceps, or maybe pentaceps to account for a 5th muscle, or multiceps in order to account for a multiple potential heads of the TBI being encompassed within that muscle group. And so that kind of comes across because of the differences in the growth dissection versus embryologic studies and imaging studies, where in embryologic studies and CTs and other imagings, we're able to see it a lot closer to 100% of the TBI prevalence, whereas with growth dissection, we're seeing a very vast range from 29% prevalence to 100% prevalence. So that would be kind of the main reason for this big question here about how are we going to continue talking about the TBI, and how do we continue teaching about it, and how do we go forward from there? The next question that I came up with was when and why does the TBI fuse the vastus lateralis or intermedius? And what's the purpose for that, and how does it do that? The next question I had was, does the TBI serve a specific role within the quadriceps? And if so, what is it? Or is it merely an ancillary, kind of form an ancillary function where it just assists the other 4 muscles? My next question was, how does the variation in its form alter its function? And that kind of goes back to wanting to know the tensile strengths for the different morphologies. And then more clinically, how can it be engaged, if possible, how can it be engaged during physical therapy to assist with rehabilitation for knee injuries and quadriceps injuries? And then for more surgical approaches, are there better ways of performing surgeries or allografts in the quadriceps tendon to keep the TBI intact? Or from a vice versa perspective, can we use the TBI as an allograft and keep the rest of the quadriceps muscles intact? So a lot of these are very unanswered questions that we don't really know the answer to. Again, because this is such a newly discovered and newly studied muscle. So some limitations to this study was when it came to the neurovasculature, my analysis was dependent on how well the first-year anatomy students dissected that area. I really only focused on the muscular component of it. And then I left the neurovascular component to the anatomy students in lab. And so some of them were kept intact pretty well, some of them were not. And so that kind of limited what I was able to do there. And then in addition to that, the TVIs that I was able to analyze were only those that I could easily separate from the vastus lateralis, intermedius, and medialis. Anything that stayed fused, I wasn't able to easily identify, and so I wasn't able to analyze as a result. Here's my references, and then anyone who knows me knows I love showing off my family. So I got a picture of my wife and my son and my daughter. All right, and so that's all I got.
Awesome. Great presentation, student Dr. Kalu. Well done. Super articulate, great images. If anyone has any questions, feel free to either raise your hand in Zoom, or if you can't talk, you can type it in the chat and I'll read it. That way it's in the recording later too. Yeah, anyone have questions, comments? It looks like there's a question from Kiana.
Hi, George. Good job. That was awesome. I like the name Multiceps. That's cool. My question, I was curious on the ages from the previous studies. Did it say like what ages the specimens were from previous literature that the research was done on? Because I know our cadavers are a little older.
Mm-hmm.
You may have said that. I don't know if I missed it maybe.
No, I didn't say it too much, but a lot of them tended to be older, with the exception of the ultrasound study that was done on, I think the average age was like 21 years old. So it was a lot of like college age students or college age people that they were looking at using ultrasounds. But by and large, a lot of the gross dissection studies were done on older individuals. The other ones that were more scans, those ones didn't really specify an age. I would assume they're probably kind of all over the place, but my guess is they were probably older, but I don't know.
Thank you. I was just wondering, there's probably maybe like different sizes and different ages. I don't know.
Yeah.
That'd be interesting. Thank you.
Yeah.
Any other questions, comments? Dr. Wolf?
Yeah, thanks, George. I really enjoyed that. I had a couple of questions that came up as I was looking at this stuff and thinking about things. And so the first one had to do, I'm always interested in function. I don't give me structure without function. And so I was wondering to what extent they might be trainable. Do tendons increase in size with train, atrophy with disuse, just like the muscles might do that? And when I first got here and was thinking I might want to try to set up some muscle studies, among the things that I also read was that a lot of damage happens to muscles when they're under load and are being extended. And so I don't know how that necessarily fits in here, but let me tell you what I was thinking about as I looked at your distribution there, and I'm going, how many of these people were right-footed?
And that was one thing that I had considered a lot too. One of the questions that was going on in my head as I was doing the study was, does the TVI have like a more of a prevalence for, or maybe
yeah, I was thinking of it as being important for the foot that was planted, that you needed that firm thing. So if you're right-footed, you're going to be planting your left foot, and that if you were somebody that did some of that stuff, like handedness, for example. The last time I looked at handedness, that was there was evidence that it was occurred in utero based on levels of androgens, for example, that if you had higher androgens in utero, that you were more destined to be left-handed. So, and I'm going, well, if there's something there that's triggering handedness, maybe those same triggers would be acting to prepare the person for being left-footed or right-footed. And that might drive formation of that additional muscle. Yeah,
I considered that too. Excuse me. I considered that too. But then as I was doing more research, I started to see that a lot of like the CT scans and embryology scans were seeing it in both legs. So that kind of threw that idea out the window for me. But that was one thing that I did think about for a long time as well.
Yeah, if I was going to do ultrasound, I mean, I'd look at the ultrasound and I'd ask people how active they were and which foot they used.
Yeah, that's something I would do too. Yeah, cool. Thank you.
Dr. Kurla, do you have a question?
I put a comment in the chat about very, very nicely done. Even an internist could follow. So, but my question is, or my pondering, almost related to Dr. Wolf's questions, which is kind of scary, but I'll admit to it, that I wondered if certain sports or dance forms demonstrated certain patterns or predilections.
Yeah, I was wondering that too, and I wasn't able to find anything on that. So that would be one thing that I would probably look at too going forward as well.
Okay.
Yeah.
Thank you. Great job.
Thank you.
Any other questions, comments? I do have a question. It's less related about the topic and more of just why you're interested in it. But I was wondering how you found this kind of surprising fifth muscle that's not really talked about. Is it something you were looking for in the literature and you came across it, or were you like dissecting and you noticed it and you thought you'd research about it?
Yeah. Honestly, I was looking to do something more, initially when I was trying to figure out what to do for my research project, I was trying to do something with the knees or something related to the knees, because I've had knee surgery to repair my patellar tendon when I was in high school. And so that was kind of something that kind of brought my attention. And so as I started kind of looking into anatomy research relating to the knees and the patellar tendon and the quadriceps tendon and things like that, this popped up. And I started like kind of looking into it, and I was like, hold on, like how is like this possible fifth muscle not really been like looked at? And how is it that we're just now seeing this when anatomy research or anatomy, let me say it this way. Most of the muscles in the body have already been determined and identified. And so the fact that a new muscle is popping up kind of this, far along, I thought was really interesting. And there isn't really a lot of data on it. And so I wanted to kind of get an idea and see if there was something I could do to kind of contribute to that, and look more in depth into that as well.
Awesome.
Yeah.
Last chance. Any other questions, comments from anybody? Well, if not, thank you so much again, student Dr. Kalu. Great presentation. And thank you everyone for being here today.
All right. And thank you, Anne-Marie, and thank you for everyone coming. I appreciate it.